first off, I want to thank you, Dr. Rainville, for taking time out of your very busy day to come talk to us, future medical students, about your journey and the advice you have for us. So I really appreciate it.
Oh, my pleasure.
Yes, so first off, I want to start by introducing Dr. Rainville. He's a board-certified general and bariatric surgeon, originally from Dallas, Texas, right? We're going to talk a little bit about that later on, how you moved here to Jersey and the New York City area. And he moved to New York City in 2006, where he completed his general surgery residency at the Albert Einstein School of Medicine. And he went to specialize in robotic and bariatric surgery at the University of Texas in Houston. So you're back from Texas,
That's
New
right.
York,
Yeah.
there and back. As of today, Dr. Rainville has performed the most bariatric surgeries in the entire state of New Jersey. And that's just phenomenal.
Robotic bariatric cases.
Robotic bariatric
That's correct, yeah.
Yeah, that's phenomenal. I actually had the privilege of observing Dr. Rainville's bariatric surgeries, the robotic ones, and what a professional you are.
Thank you.
It was just so natural, and you got right into it, and I don't know, it just felt so put together.
I'm glad you enjoyed it. Yeah.
It was a phenomenal experience. I witnessed maybe 2 or 3 cases.
That's right.
And it was phenomenal. So he's also the medical director of the robotic surgery at Hackensack UMC Mountainside Hospital, and is an instructor and proctor to surgeons across the whole country for the DaVinci Robotic Surgery.
That's correct.
Okay, so I want to start off by asking how you were growing up. What were you like? What were your interests?
Well, it's funny to think about my childhood again. I grew up, like you said, in Dallas, Texas. I was actually the youngest of 7 kids. I had 1 brother and I have 5 sisters. My father was an electrician. He worked for the telephone company, and my mother, she worked for the Yellow Pages. I don't know if you know what the Yellow Pages is. Before the internet, that's kind of how you found phone numbers for anything. I guess I was probably a regular kid growing up. I was into sports a little bit, played baseball. I love video games. I think I was a generation, that grew up when video games kind of first emerged as being real popular at home. So I do have a lot of memories of playing video games with my friends as kids. But also I enjoyed being outdoors. We did a lot of stuff outdoors. Most days, getting home from school, we'd get on our bikes and go out in the neighborhood, and we wouldn't get home until it got dark. And that's a lot of my memories from being a kid. School was always very important, to my parents, and they kind of stressed that upon me. So that was kind of a priority. I kind of grew up, having a lot of emphasis on.
Okay. Yeah. So they emphasized school, but they didn't push specifically medicine, right?
Well, that's interesting. I get asked that a lot. When did you know you wanted to become a doctor? And it's funny because since I was really young, I remember my mother always telling me that I always wanted to be a doctor. And part of me is not sure if that's the truth or if it was kind of a seed that she was planting, in my head, and just continuously watering it as I got older, because she would always tell me, yeah, you always wanted to be a doctor. You want to be a doctor. And so in my mind, I was like, okay, yeah. And it did make sense for me. In school, I always enjoyed, the courses and subjects that were science related or math related. Those are the kind of classes I always not only found the easiest for me, but the ones I was had the most interest in. Same thing as I would get excited, for things like the science fair. Those were always things that excited me. There was probably a period of about 4 or 5 years in a row from I think 6th grade till 9th grade that I made sure I won first place in every science fair. Because it was a challenge, and it was also something that I got a lot of support from my dad, and he would always want to participate and help me. And we'd make this very extravagant or over the top science fair project. But those are good memories I had, but I think all that stuff kind of contributed to my passion for the sciences, and then eventually wanting to pursue medicine.
So your interest for science was early on in life, right?
Yeah.
Okay.
It was, and I do think that a lot of, even seeing with my kids now, I think very early on you realize, passions that are natural, that kind of come out in individuals. And I see one of my daughters that she's very into arts, and it's very evident. She's just going to be 5 years old, but I feel like it's already emerging that in her personality, that's what she's passionate about, that's what she enjoys. And for me, I think early on it was always science.
Gotcha. And let's talk about high school. So we talked about your childhood, high school, and then leading on to college.
Sure.
Since you were interested in the sciences, did you have extracurricular activities that leaned more towards healthcare aspect? So let's say volunteering or research?
So I was involved in a fair number of extracurricular activities. I did have to start working pretty early on. I had my first job actually when I was 14. And from the age of about 14 until I started medical school, I think I always had a job that I at least did part-time, a lot of times after school, just to earn extra money to help pay for things. So yeah, I probably had, between the time of high school and college, probably close to around 8 to 10 different jobs. So that took up a lot of time. I did play sports a little bit. I played baseball. I was part of a math Olympiad team. I enjoyed math a lot. My dad was also very big into chess, so I kind of participated a little bit in the chess club. As far as things that I was also interested in, I did get involved a little bit in political campaigns, and worked for a couple of different political campaigns when I was in college. Unfortunately, none of the candidates that I worked for ever won the position they were running for. But it was a good experience, and it taught me a lot. Mm-hmm. Yeah.
But specifically in terms of, because I know a lot of our viewers now what the stigma is that you're required to have volunteering experience and medical research or scientific research experience. Did you have any of that going into?
It's interesting. So volunteering I did do. We did a Meals on Wheels program. I did a Big Brother program for the YMCA. Most summers I actually worked at the YMCA as well. It's funny. The trend has changed a little, but when we were in high school and even in college, if you knew you wanted to pursue a field of medicine, we were actually encouraged to participate in things outside of, necessarily the sciences, because medical schools typically know, that you're going to be strong at science and you're going to be strong at math. And they want to kind of see that you have a broader horizon. Even things, small things like getting a Bachelor of Arts rather than a Bachelor of Science just kind of showed that you had a little bit more depth to, I think, your experience. So we were actually encouraged to participate in other things outside of, just the sciences.
Just the sciences and just out of healthcare, right?
That's right. I did a little bit of, research in my last year with my biochemistry professor. In college, I majored in biochemistry. And, part of that was I found biochemistry as one of the more intimidating subjects, and kind of rather than worry about it or fear it, you kind of just, I'm going to embrace this. I'm just going to major in this and kind of take this the subject that intimidates me the most head on, and so that way it kind of takes your fears away from it a little bit. And
that's actually great you mentioned that. So now I want to talk a little bit about your strategies for coping with stress, or sort of your time management skills that you had during college, because I'm sure many of our viewers, because these science classes are rigorous and you have to be on top of your work, and then you have to prepare for the MCAT in addition to all the other extracurriculars all of you might be participating in. It is difficult to manage. So what are some strategies you learned throughout your experience in high school, college, and then later on taking them even to medical school and beyond?
It's a great question, and I think everybody's got to figure it out individually. And some of it's kind of, trial and error. I think when you first start college, you may not be aware of all your strengths and weaknesses, and you kind of learn as you go. Early on, I realized during that time of my life, when I was 19, 20 years old, that it was not a good idea for me to take all those earliest classes. I learned that 8 o'clock classes for me, just didn't work out well. I ended up paying the price for it. But you live and you learn, and so you start to realize what you're strong at and what you're not strong at. And so then after I realized that, I started scheduling my class schedule to start a little bit later. My grades definitely improved. Also, I joined a fraternity when I was in college, and I joined it early on. But the good thing about it was, we did a lot of social things together, as most fraternities do, but they were academically focused, and even when I was joining them initially, they forced us to study, and they made you turn in a number of hours that you spent at the library. And the first year that I joined that fraternity, I had the highest GPA that I had the entire time in college, and so it was kind of reinforcing that this was, it was not just going to be about social life, even though that was part of it. It was a lot about academics as well.
It was like a community type of setting.
Absolutely, yeah. And you meet a lot of people that have shared interests, you meet people that are also pursuing, a career in medicine, and then you work with each other and lean on each other to, help with things that you might be good at or they may be good at.
And this was back in Texas, right?
That's right. I went to Baylor University, back in Texas, which was a fantastic experience for me. Enjoyed it very much.
Those strategies that you learned during college and high school, were you able to apply them to medical school, would you say? Or was it completely different? Okay.
No, I think, one of the things I definitely had an advantage of is I've always been pretty good at standardized tests. So, multiple choice questions, things like MCATs or SATs and stuff, I was always able to perform very well on those. Other courses where you had to write papers and things like that was always kind of my weakness. But a lot of the courses that I really focused and tried hard on in college made it much easier for me when I got into medical school. And also kind of the studying techniques that you'll learn work for you, in college, you use those in med school. And I think, a common thing I hear, sometimes students will complain about is saying that a certain subject say, I'm learning this stuff now, but I'm never going to use, the periodic table, or I'm never going to use this specific organic chemistry in the future. And I guess the point is, it's not really that you're going to use those things. It's just kind of they wanted to see, can you? Like, do you have the ability to understand this? Mm-hmm. Do you have the ability to kind of figure this out? Because, you might not use this particularly, but do you have the ability to kind of adapt and not only understand this, but actually excel at this? So it's more kind of, I think, you're being tested, in each of those subjects rather than needing that material, in practicality in the future, right? You're just kind of being leveled against all your peers.
Yeah, definitely. Yeah. I see it. Definitely some people do use organic chemistry and all the biology fundamentals, maybe if they're involved in research, clinical research,
absolutely.
and so on. But I definitely see it as a way to definitely assess if the person's able to think dynamically, because that's the type of thinking that you will need to have in your healthcare setting. Because even those organic chemistry mechanisms could be very sophisticated and difficult to follow, as I'm sure many of you could agree with. Those similar mechanisms are involved with patient care, right? As we have diseases and we need to understand their mechanisms, they're far more involved. So definitely I do agree with you on that point. I want to move a little bit on further to your residency. So strategies for test taking and stress management, we talked about for college and for medical school in terms of tests, but the residency aspect, that's a little bit of a different story, right?
No, absolutely. And, I have mixed feelings when I go back and think about residency because, obviously it's a great experience. It's unforgettable. It's where I think, almost all of the knowledge that you use when you're practicing medicine, it seems like most of it comes from that last portion of your training. It can be a little traumatizing. I mean, I think especially, a surgery residency, I'll be honest with you, it's something I would never want to do again. I mean, it probably sucked a little bit of life out of me, but I think it's important. And just, this communal acceptance, and I meet another surgeon, and I know they went through a general surgery residency. I mean, I immediately have more respect for them, and I think they see me, and we see each other, and just delight that, we had this communal experience that we got through, and we got to this point now. And so, no, it's difficult in a lot of ways. It stresses your emotions, it pushes kind of your body to the limits. As far as what you're capable of doing and how you're able to function day to day, but it is different, because you're still trying to learn academically, but you're also trying to perform as well. You're still being tested, but you're given a lot of independence, and a lot is expected of you. So I think maybe that in that time of your life, you may learn more about yourself than at any other point in your training.
Gotcha. It took up a very big portion of your time because we're in between cases. I just wanted to sneak in one more question, if it's possible. Why specifically robotic bariatric surgery, and specifically robotic surgery? I'm thinking it's because you mentioned earlier your video gaming background, and it sort of seems when you were operating that DaVinci machine, it feels like a video game, right?
It does. It sounds silly to make that comparison, but I mean, honestly, I think there is a validity to that point. I do feel like sometimes when you're in there, it's very similar to playing video games. I mean, you're controlling something with your hands, hand-eye coordination, and I think as the technology advances, having those experiences as you're younger, do play a role in that. It's funny, I see some of these older docs that maybe didn't grow up playing video games, they struggle with it a little bit more, and I think, Paul, if you jumped on there, you could probably fly on that machine. You know, and at the time it was kind of an emerging technology, so I kind of saw a niche for myself that I could be part of something that I knew was going to continue to grow over time, and I want to jump on board early. And yeah, we've seen great success with it. Our patients have done, you know, phenomenally well. I definitely see a huge advantage for their outcomes over traditional types of surgery.
Okay, perfect. Yeah. Well, thank you so much.
Of course, Shon. Yeah.
For speaking with all of us and sharing your advice and journey in the field of medicine.
Oh, thank you. My pleasure. Take care. Good luck.